At this year's European Society of Medical Oncology meeting in 2018, we have finally seen some practice-changing results, particularly in the presidential symposium, some of which led to New England Journal of Medicine publication simultaneously on the same day. First and foremost, Philomath Read, which, as you all know, is a second-line randomized trial of fulvestrant with or without palbociclib. And as we know, we have 3 CDK4/6 inhibitors in the market that we can prescribe in first and second line. And in the first line, in general, there's 10 to 12 month prolongation of progression-free survival for all 3 of them. In the second line, there's anywhere between 3 to 7 month prolongation, but we did not have any overall survival data. So finally, Philomath Read survival data was mature enough to be presented. And what we saw was about a 6-month prolongation overall with the addition of palbociclib to fulvestrant to go from 28 months to 34 months. However, the p-value was not statistically significant. When you looked at the previously less heavily treated subset of patients, then you did see a bigger benefit and statistical significance. Whether these results will change practice patterns remain to be seen, because CDK4/6 plus hormonal therapy has become the new standard of care, at least in the United States, and we are already prescribing these drugs. Whether some people will be misled to believe that they should really save palbociclib for second line, where it may have a survival advantage, and not use it in the first line, at least to me, does not make any sense. We just have to wait longer for Philomath 2 to mature, because those patients are obviously doing better and living longer having received this in the first line setting. Another very interesting study, which is a first as well, was immunotherapy in triple negative patients. So more than 900 patients were randomly assigned to receive atezolizumab or not with Abraxane backbone as the chemotherapy. And in that study, patients who received nab-paclitaxel plus atezolizumab, they had a significantly longer progression-free survival. And at this preliminary follow-up of 20 months, there was even hint of longer survival, actually an more impressive prolongation in survival from 15 months without immunotherapy to 25 months. But a 2-month progression-free survival advantage as well, from about 5 months to 7 months. So these are exciting first results of immunotherapy adding to chemotherapy in triple-negative breast cancer. Of course, further research is needed and other studies are maturing, and we look forward to that. In terms of precision medicine, we finally saw some positive news in the group of drugs that are called PI3 kinase inhibitors. Previously, BEL2 and BEL3 had not really led to any results that would relate to any meaningful benefit. But this time with the Pelisib, SOLAR-1 trial results were presented by Dr. Peter Schmidt. Previously, Sandpiper study had shown a modest 2-month progression-free survival advantage with significant toxicity. This time with a much larger group of patients, randomized phase 3 trials, and with the circulating tumor DNA showing PI3 kinase alterations, we actually saw a clearly positive result with significant p-values. There was toxicity, however, hyperglycemia, rash, diarrhea, but hopefully there'll be manageable toxicities. And I think it's looking like this drug may get approval based on these data. Finally, an HDAC inhibitor trial, again in later line, after failing first-line aromatase inhibitors or tamoxifen, patients were randomly assigned to exemestane, one of the prior standard second-line therapies, to exemestane plus HDAC inhibitor. And that study also turned out to be positive. And I think we should stay tuned to see if other HDAC inhibitors that have already been tested also show us positive results. So it's a very exciting time in breast cancer research. Thank you very much for your attention.